Today we're going to demonstrate how to administer the injectable immunotherapy. Okay, this is the schedule for when we're first starting out right after the allergy test, and we are going to wait at least 48 hours before starting injections. And we have two vials here. This is vial A and vial B, and they are color coded so that you can tell the difference between the two. We're only going to use one vial at a time. We are going to start with vial A. These are going to live in your refrigerator until you're ready to use them. So when you are ready, take out vial A and just give it a little shake. And we are going to take our syringe. So you take this part off and then take off the lid. Here's your needle. You're just going to put it right in the middle of the gray part. Turn it upside down. Pull the plunger down. And I'm pulling it a little bit past what I need and then pushing it back just to get the air out of the syringe. So 0.1 cc is our first dose. So we're going to take the needle out of the vial and get our patient here. Hi, sweetheart. Okay. Now you're going to lift up on the skin with your non-dominant hand, just like this. Now I'm a lefty, so you might do this the opposite direction, but just make sure and lift up, and you're gonna put the needle right in this area here. I call it the tent, the triangle, whatever you wanna call it. So make sure and put the needle straight in, 45-degree angle, and then pull back to make sure there's no blood in the syringe, and we're clear. And all the way in, push the plunger until all the liquid is dispensed, and then pull it straight out. And that's all you need to do. It is best to stay in this general area here. The higher up you go, the more sensitive it tends to be. So anywhere in this area is fine, okay? Once you've given the injection, you're gonna take this little clipper. It looks just like this, and you're gonna push there, and that's going to open up and put the needle right in there, and clips and hold it for you, and the rest of it you can throw it away, okay? So that's our first injection. So you're good for the week. So the following week, you're going to give a little bit more. So we're gonna do 0.25 cc. I'll show you what that looks like. Right between the 2 and the 3, okay? And then the next week, we're going to do 0.5 cc. And the week after that, we're going to do the full milliliter, okay? Once you've given that fourth injection out of vial A, you can throw it away. You don't need it anymore, and we'll go to vial B the next week. That is the same schedule as vial A at first, so we'll start out with 0.1, 0.25, 0.5, and 1, and just make sure that each of these is just once a week, all right? So the first 8 injections are 1 a week. After this injection, we're gonna wait 14 days before giving the next injection, and after that, it's 1 cc every 14 days. That will be your long-term schedule going forward. And we did highlight this area here because it is important after you give that very first injection to hang out with your pet for an hour or so, and just make sure they don't have any adverse reaction to the injection. If you see any of this, fainting, vomiting, or diarrhea, treat it like an emergency, go to your regular vet. It is very unusual to see this, but we just want to make sure that you're aware so you can keep an eye on them. This is a lifelong therapy, so we want to make sure that they stay on it consistently. There will be a reminder on your first schedule to call us to schedule a recheck. We'll do an evaluation, make sure that the serum is working well for them, get you a refill at that time. After that, we can either mail the serum to you or you can pick it up at our clinic.